Hello, my name is James Hartsfield, and this is my video recording for my head, ears, eyes, nose, and throat assessment. I will begin by scanning the room. Behind the desk as well. These are the tools I'll be using. And then for this assessment, I don't have a vision chart. I also don't have an ophthalmoscope. So I will be just simulating and verbalizing whenever I use those. In any equipment that I don't own, I will just verbalize that I will be using it and what I'll be looking for. All right. To begin the assessment, the first part is the head and neck. So I would approach the patient and begin with inspection. I will be looking for any immediate asymmetry, any immediate lesions, any immediate thing that would be considered abnormal. This is done with a quick inspection. I will then begin with palpation by starting at the top of the patient's head and working my way slowly down both sides. I will feel to make sure I feel a pulse in the temporal arteries and continue down. While I'm here, I'll go ahead and ask the patient, please open and close your jaw a couple of times, listening for any clicks, any sort of displacement. I'll then slowly move my way down the neck. I will assess for placement of the trachea. I'll ask the patient, please swallow. Feeling for the movement of the hyoid bone, make sure it moves up and down, that there's no deviation. While I'm at the neck, I will go ahead and palpate lymph nodes as well as I move behind the ears and down the neck to palpate for lymph nodes, lymph nodes inside of the triangle on the neck on the bilateral sides. I will then palpate for the thyroid gland. I should not be able to see the thyroid gland. I will have the patient please turn your head to the right. And now please turn your head to the left. Make sure there's no swelling. Make sure I can actually palpate something. Make sure that there's no goiter, things of that nature. You may turn yours back center. Thank you. As I said, I'm looking for any sort of asymmetry, any sort of drainage, any swelling, any areas of redness, any lesions, any pain. I will also test the patient's range of motion with their neck. I'm going to slowly move your head. Please follow me until it becomes painful. Please let me know if it becomes painful. As I do this, I'll be looking for any sort of webbing, any sort of malformation on the neck and the head. Okay. All right. Lastly, I will auscultate for arteries on bilateral side, the temporal, occipital, and the thyroid arteries. Listening for any sort of roots, any sort of unlikely, any sort of strange sounds, any sort of improper flow, any sort of whooshing, anything of that nature. But I do need to auscultate to ensure that it is there, or that everything is within normal limits. I will then move on to the inspection of the eyes. Again, I begin with inspection. The first thing you will note is, are there any sort of, any drainage, anything that immediately stands out upon inspection, any discoloration, anything of that nature. I also look to see, just on immediate inspection, if the pupils are the same size bilaterally, if they're both round, if the irises are both the same color and the same shape bilaterally, and to see if there's any major bleeding or redness inside the cornea and the sclera. As I said, I do not have a vision chart, but to test long distance vision, I would have the patient stand 20 feet from a Snellen chart and please cover your left eye.
Right now?
Yes. They would do this. They would read as far down as they can go, and then I would say, okay, you can uncover that eye. Now please cover your right eye. I then have them repeat this process with the left eye, but reading the lines backwards, right to left, going down again as far as they can go. If the patient has any corrective lenses, glasses, contact lenses, things of that nature, they would do the test unaided first, and then they would do the test with their corrective vision appliance. I would test the short range vision by having them hold a chart approximately 10 inches from their face, and again repeating the process, reading as far down as they can go. Right. So I will not actually do it, but I will be simulating a cotton tip. I would gently hold the eye down, and I would just gently touch the white of the eye with the cotton tip, and what should happen is bilaterally the patient should have a blinking reflex if the cornea is responsive in the way it should be. I will assess bilaterally the lacrimal gland, just to ensure that I don't feel any swelling or any blockage. Again, I have the patient please look straight ahead. I will very gently lift the upper eyelid and the lower eyelid to ensure that I see no lesions, no growth, no sty, and that again that there is only minimal vasculature inside of each eye, that there doesn't appear to be any hemorrhage, any yellowing, anything of that nature. I will then test the patient for their ocular motor functions and also for accommodation. Please follow this with your eyes only. I will be moving in all 6 fields of vision very slowly, making sure that there is bilateral eye movement. All right, continue focusing on my object. Focus only on the object. I am now testing accommodation. Both eyes should move inwards towards the medial canthus as the object approaches. I will now test pupillary reaction to light. I will cover one eye. Please look straight ahead. The pupil constricts, and then test the other eye. Pupil constricts. Then what I will do is test the bilateral response to see, please look straight ahead, and please look straight ahead. Yes, the opposite pupil constricts even when the light is shown into the other side. And lastly, what I will do, again, I'm simulating it, but I would use my ophthalmoscope. Start from a distance, slowly move into the patient's eye. And what I'll be testing for here is the red reaction. I'll be looking for any macular degeneration. I'll be looking for the placement of the optic disc. I'll be looking for any dark spots that may suggest any sort of hemorrhage or blockage or any sort of object in the eye. And again, I'll be doing this bilaterally. I'm sorry, there is one thing. I also need to test peripheral vision, and I have these 2 objects here. So I'm going to turn the patient slightly this way. Alright, please cover your left eye with this paper. Thank you. I will also cover the corresponding eye And I will move my finger slowly into the field of vision. Please let me know when you can see my finger.
Now.
And now I'll repeat the process with the other eye.
Now.
That is the confrontation test, and they should, assuming that my vision is good, they should see my finger approach the field of vision at approximately the same time as I do. Finally, moving on to the inspection of the ears. Again, the first part is just what I can observe, inspection. I will be again looking bilaterally for any apparent bleeding or drainage or any earwax that's just visually apparent on inspection of the outside of the ear. I'll also be looking to make sure that the auricles are about the same size bilaterally, that the placement on their head is approximately the same bilaterally. I will draw an imaginary line from the lateral outer area of the eye across the head to see if the pinna comes up approximately over the eye and no more than 10 degrees back bilaterally. I will then begin palpation. First, just a ginger touch to ascertain, if there is any painful areas, just on a light touch. Also, just with a slight pull of the ear to see if there's any pain there. I'll also test the sinuses while I'm here, the frontal, orbital, and maxillary sinuses, for any pain, any signs of pressure that might indicate some sort of sinus buildup or infection. I'll then look inside the ear. For an adult, you're going to pull the pinna up and back to straighten out the canal. And I will visualize inside the ear. What I'm looking for is any redness, swelling, any sort of, some earwax will be normal, but any amount of earwax that would occlude the patient's hearing that may be causing pain or, again, loss of hearing. I'll also look at the tympanic membrane to make sure that it's a gray, sort of opal, pearlish color. Look for any perforations on the tympanic membrane, any bleeding, any redness or swelling on the tympanic membrane, any drainage of any kind that would suggest a middle ear infection. I will finish by testing the patient's hearing. Again, this is going to simulate my tuning fork. I would first strike the tuning fork, place it center line on the vertex of the patient's head, and ask them which sound they hear first. And they should hear the sounds approximately the same amount of time bilaterally, assuming that the conduction is not being occluded in any way. I would then, for the rind test, strike the tuning fork, place it approximately an inch from the patient's ear, and then place it up to the patient's, the bone behind the patient's ear, asking them when they stop hearing the sound both times. The air conduction should be heard longer bilaterally than the bone conduction, assuming that there's no neural loss and no issue with the auditory canal, and there's nothing wrong with the auditory nerves. I would then do the whisper test. I would stand behind the patient. I'm going to whisper 3 words. I want you to tell me what those words are, 3 objects or letters. I want you to tell me what they are.
A1C. A1C.
And then on the same side,
P52.
Again, the patient should be able to repeat back both. And this concludes the. Oh, I'm sorry. I will then inspect the patient's nose, same as before. Any sort of bilateral asymmetry that may be an issue. I will check the nares for patency. and ensure that there's no septal deviation, no blockage, minimal. There may be some mucus, but only minimal. And looking for any drainage. I'll also palpate to ensure that I feel no areas of swelling or tenderness or deviation. Lastly, I'll have please open your mouth. I will check the patient's mouth, the uvula, to ensure that it's there, tonsils if they are present, if they are, any swelling that might be there. Please keep your mouth open. I'll check both the lower and upper gums for any swelling, signs of, say, gingivitis. I'll check the teeth for any dental caries to count the number of teeth to make sure all the teeth are there. And then I'll say, please stick out your tongue. And I will check the tongue for any swelling, any glossiness, and to make sure that the tongue actually sticks out the same and there's no deviation to one side or the other that might indicate an issue with the cranial nerves. And this concludes my ear, eyes, nose, throat, and head inspection. And I would then move on to another system. Thank you.